So this session is entirely on how to handle those challenging situations or difficult situations. So first of all, I want you to share your experience with me through the chat box. What kind of difficult situations have you come across so far? Okay, one of the challenges that you can have is language barrier. Okay, I cannot agree more on this. Of course, it could be a huge challenge. Okay, anything else? Any experiences that you are able to recall from your experience working maybe as a student nurse or as a medical student or working as a doctor or nurse where you simply didn't know how to handle that situation? You were stuck. When it gets really tough to keep talking to your patients, or when it in what all situations do you think it's really difficult to manage that conversation further? I'm sure all of you have some experience of working with patients. You can have introvert patients. Yes, that's really tough on us, being a healthcare professional, because if the patients are not willing to share their ideas, their perceptions, and their feelings, then it's really challenging for us to understand what are their desires, their wishes, and how do we cater to them, right? Yeah, so my question, Rainy, is what are the most difficult situations that you have been so far as throughout your career as a maybe as a student nurse or as a staff nurse, where you found that it was really tough for you to keep talking to the patient or to have that conversation with the patient? So two situations that we discussed was, one is when there's a language barrier, another is when the patient is introvert, or maybe they are not introvert by nature, but because of their condition, they are nervous and depressed, and then they may not want to talk more about it. So what are other situations do you think that could make it really challenging for you as a healthcare professional? Share your experience with me. When was the last time you were really scared of having that conversation with your patients? Yeah, you're right, Dr. Ubashi. Declaring diagnosis, okay, or revealing news that isn't very pleasant. Uh, yeah, I would use the term serious news rather than using the term bad news. But yeah, I completely agree with you, Rainy, that when we are about to tell the patients that um, they have a disease condition which can be fatal or very serious in nature, then handling patients' emotions becomes a huge challenge for us. Okay, so these are some of the situations which we are going to look at today. Okay, and to start with, we will learn how to reveal serious news. Okay, now there is a mnemonic that I would want you to remember whenever it comes to revealing serious news, and we are going to study that mnemonic in detail today. Okay, so there are 6 steps that you will need to follow when you, as a nurse or doctor, are about to reveal serious news to your patient. Okay, so it is popularly known as spikes format. Some of you might have heard about this, for some of you it may be new. So let me explain you what it is. It's basically the six things that you need to keep in mind when you are about to discuss serious news with your patients. Okay? So the first, as here, stands for setting. Of course, when you are going to have discussion which is confidential, you're going to have discussion which can have strong emotional reaction from patient. You wouldn't be discussing those things in the general ward or in the corridor or at the nursing station. Yes, you would definitely arrange a meeting privately, maybe in a family meeting room or maybe in a counseling room. So you'll ensure that it's quiet and there's no background noise. Another important things you should keep in mind is that you should first have a good rapport with patient before you actually start giving that news. If possible, you should have close relative with them, one of them, and your body language. Okay, where are you sitting? How much is the distance between you and the patient? Um, and then your eye contact with them. Uh, if it is culturally acceptable, then touching them in an empathetic manner. So these are all the things which are important. Now, as far as OET speaking is concerned, you don't have to worry about the setting at all because it is OET that will be setting the room for you, right? It is going to be basically an examination room, so it is going to be quiet. And then, as a part of your exam, you are not being assessed for your body language. So, you will not have to examine or touch the patient in any way, but of course, you can have a good eye contact with them. You can work on making developing good rapport with the patient, and then it would definitely have some positive impact on the interlocutor who is going to play the part of patient. The second thing here is perception. Now, when it comes to medical knowledge or diagnosis or disease conditions, it's very, very common that the patient's belief can be very, very different from the reality. Okay. For example, your patient comes to you with a simple headache, okay, and because it did not resolve for about 3 months, you order a CT scan and you find that there is a tumor, but it may happen that the patient would haven't ever thought about having a tumor. They might have thought that it is migraine, or maybe it is just headache due to stress, or maybe due to climate change. On the other hand, there can be situations where the headache is actually just because of stress or climate change, but patient is perceiving that they may have a brain tumor. So perception builds up because of your surroundings. If anyone in your family or friend has a particular disease condition, then the patient would be more likely to think about having the same condition because they have seen someone from very close, the symptoms. So before you giving the news to the patient, it is important that you find out what is their perception about the condition. So you can ask a question like this: how much do you know about your illness? Or what has anybody told you about your symptoms? Okay. Or, say, for example, uh, most of the cases, whenever you are revealing serious news, it will be a follow up appointment, isn't it? The patient might have seen you, you might have suggested some test, and now they are coming back to find out the results. So it's going to be again a follow up visit. So in order to know their perception, you can also ask them, so like, what are you expecting from the result, right? And that's really, really common these days, particularly because of Google. If you have ordered a CT scan or an MRI, the patient would definitely go back and check why these tests are necessary or what could be the possible diagnosis. Okay? So before you saying that your CT scan shows that you have a brain tumor, it's a good idea to say that, can I ask you what was going on in your mind when while we were doing all these tests, and what are you expecting from these tests? So you get to know whether the patient is expecting to have brain tumor or they're completely ignorant about the fact. And knowing that will help you handle that situation better. Because if they haven't ever thought about having a tumor, and if the result shows that there is tumor, then they will be really shocked. Yes. And then how you handle that situation will be very, very crucial in that stage. The next is invitation. Now, what happens is when it comes to um, knowing about their own disease conditions, different patients will have different preferences. For example, you will see some patients who would like to know in and out. Okay, they would like to know where exactly is the tumor, what size is it, whether it is cancerous or not, how are we going to take it out, how many hours would be the operation of, how many days would it take for them to recover. And then there is another category of patient who would say that, doctor, you do whatever you want to do, but let me know how much would it cost me, and whether I would recover fully or not, right? So what you would do before you discuss everything with the patient, you would invite them how much would they like to know about their condition. Okay, for example, if it is an elderly patient, will they like to know everything, or will they like you to talk to their children about it? Similarly, if it was a husband or a wife, you would also like to, you can ask them whether they would like to know everything, or whether they want you to discuss it with either with their husband or their wife. So that is invitation. What all phrases can you use here? Okay, you can say, um, would you like me to tell you everything about your illness? And then you can give them example that there are some people who would only like to get brief information, and there are others who will like detailed information. So how much would you like to know? Fourth stage after that is knowledge. This is actually the stage when you would be giving that serious news. What you will have to take care of here is your tone. You need to use expressions that will soften the news, and the use of pauses as well. So rather than straight away saying that your CT scan shows that you have third stage of cancer, you would go slow and you would say, I hope I wouldn't have to say this, and then a short pause. But unfortunately, the test results indicate that you have. Okay, and then you go on to give the diagnosis. That too, very slowly, saying that we have found that there is a tumor in the ascending colon or descending colon, for example. And then, unfortunately, since we couldn't catch it early, it has also affected your liver, or it has also affected other body organs. That is how you slowly and gradually reveal the news. Okay, and you will be using expressions like I'm sorry or I'm afraid. So three things, like using those kind of expressions, pausing at an appropriate stage, and going very slow about giving the details of their diagnosis rather than saying everything in one go. After knowledge, once you have revealed the news, it is now the patient's time, okay, how they are reacting to that situation. How would you handle their emotions? You'll have to take care of two things here as well. First is use exploratory language to allow patient to express their emotions. Okay, uh, don't tell them that, oh, don't worry, there's nothing to worry about it. No, please don't use those kind of phrases. It will turn the patient off. They wouldn't express their feelings, or their fears about having that diagnosis. Instead of that, try and eliminate that fear of being judged and try and encourage them to talk more about their fears. Okay? And when they are expressing their fears, use empathetic language. There is difference between sympathy and empathy. Okay, sympathy is feeling sorry for someone, sympathy is feeling pity on someone. Empathy is different. Empathy doesn't mean that you are feeling someone is weaker. Empathy is you put yourself in their shoes, you try and understand how they might be feeling, okay, at that point of time. So these are some of the phrases which you can use to show empathy and to normalize their reactions. Even if they are crying, you normalize that by saying that anyone in your situation would have similar reaction. If I were you, I would have reacted in the similar way. So you normalize their reactions, you normalize their feelings so that they don't feel being judged and they can open up more about it. And finally, once they have settled down with the news, you discuss the future planning. Like how are we going to treat that? When you are discussing strategies, be positive and plan treatment and follow. Right? So Spike's format is something that you will be following when you are revealing serious news. And as I said, as far as OET right speaking is concerned, you don't have to worry about the quiet room and the privacy part, but you will have to take care of good rapport and body language. And of course, your tone and stress patterns. Okay. And then these are the steps which you will need to follow. What we are going to do next is I'm going to play a video. And while I'm playing the video, I want you to write down one sentence that the speaker used. It's going to be a conversation between a doctor and a patient. So while you're listening to that video or while you're watching that video, I want you to write down one phrase or one sentence that the speaker, the doctor used to have good rapport with the patient or to maintain privacy. One sentence for perception, invitation, knowledge, emotions, and strategies. If you can write more than one, that's excellent. But at least one sentence, I want all of you to write. Okay? Under each of the spikes category, for all 6 stages, one sentence that the speaker uses, you are supposed to write it down. And then we are going to have discussion on this. Okay? We are going to look at one such role play and we are going to do a dialogue activity based on that. But before we do that, I just want to ensure that you have understood each of these steps correctly. So if you still have uh, unclarity, then please do me a favor, take screenshot of this page. So after watching the video, I may give you 1 more minute to see if you wanted to add anything to what you have written. Okay. So you can refer to this snapshot for setting. What does it mean by P, I, knowledge, emotions, and finally, strategies. Okay, so now I'm going to play the video. And while you are watching the video, you will need to write a minimum of 6 sentences, right? One sentence under each category.
meeting for us today to discuss the results of your breast biopsy, but I've actually given my pager and my cell phone to my nurse practitioner so that we don't get interrupted.
Okay.
Are you alone or did you come with someone?
No, my children had to work today, so I'm by myself.
Okay. So how are you doing?
I still get tired and I get dizzy if I get too tired. I've got some knee problems, and yesterday I had some nausea. Better today. I think it's probably mostly because of the blood count, my anemia.
Okay.
So I think I'm okay.
How about any anxiety or depression?
Well, I'm really worried about the test. I have a lump, so I'm afraid. I don't know about that test they did with the needle.
Have these symptoms affected your life in general, your ability to complete your housework?
Well, I've cut back my volunteering at the nursing home, but I still babysit my grandchildren.
Okay, so my clinic and I can help you with all those symptoms. We'll go over that, at the end of this meeting and in the next couple of weeks. Before we go over the results of the breast biopsy, I would like to ask you one more question. How do you handle medical knowledge? Would you like all the details of your treatment? In my family, my mother would defer to her children, especially me. How do you handle medical knowledge?
Oh, you'll have to tell me. I want to know everything.
Okay, all right. So, Mrs. Flores, I'm afraid I don't have very good news for you today. The breast biopsy revealed that you have an invasive form of breast cancer. I'm sorry. I wish I had better news for you.
How can I have breast cancer? I make all my checkups. I have all my mammograms. I don't understand.
Well, unfortunately, despite routine checkups, cancer can occur in anyone.
How long have I had it?
It's very hard to tell, but you probably have had this for several months.
No one in my family has ever had cancer, except my husband. Could I have caught it from him?
No, cancer's not like a cold. It's uncertain why some people get cancer and others don't. Tell me about your husband.
He died of colon cancer. I nursed him.
Sorry to hear that.
So I've seen how cancer can eat you up. It's ugly.
I know this comes as a shock to you.
I don't want to be in pain like he was.
My clinic and I, we're going to support you through this, and we're going to guarantee that we address your pain and all the symptoms that you're having. We're also going to be available for your family, okay? I'm glad you told me how you're feeling, because now I know where you're coming from. The next step is for you to be meeting with a medical oncologist. This is the cancer doctor and the general surgeon. Most likely they'll recommend the following, either to remove part or your entire breast. The goal of this surgery is to remove the cancer. This is going to be followed by radiation therapy and chemotherapy, and the goal is to make sure that we kill any remaining cancer cells that could be present after the surgery. I think we should focus on keeping you comfortable.
Am I going to lose my hair?
Oh.
Am I going to have to wear a diaper? My children are going to have to take care of me.
Yeah.
Am I going to die, doctor?
No, you still have many options available. In fact, I hope the best for you, okay?
I don't want to be in pain like my husband was.
My clinic and I are going to help with any symptoms you may have, including pain. I can help you with all these things. These are all issues that will arise. In fact, I'm a part of a team. In my team is a social worker. A social worker is available to you if you have any financial questions or issues. They're also available to you and your family in the event that you can no longer take care of yourself. They can provide services. And I have a great nurse specialist. She is very skilled in pain management and control of all your symptoms. She's also available for refills. And lastly, my chaplain, he can provide prayer or just basic counseling for you. Are you interested in any of these services?
I don't know, not now.
Okay. Here's a tissue. You know, I can't imagine how you're feeling, but we're here to support you and we want to provide you with the best medical care for you. We will support you in any way that we can, no matter what happens. Let's plan to meet February 1st. It's on a Tuesday at 9 a.m. So in the next couple of weeks, can you write down any questions that you may have for myself, the medical oncology team? Can you tell me in your own words what I have just said?
I have breast cancer.
Okay, so now tell me anything that the doctor did to ensure um, privacy and quiet room. Did she ensure the patient about the, the confidentiality or the privacy and um, that there would be no interruption or distraction? Could you pick up that phrase that the doctor used? Please type that for me in the chat box if you have written it. The doctor asked if they have any close relative present with them. Um, yeah, that is in perception, Dr. Urvashi. Um, Asking for the presence of any relative is to ensure that the patient feels secured and they are comfortable discussing all these issues. Right? So that was part of ensuring that the environment or the setting is appropriate. So this is very crucial when you are having real conversations with your patient. Of course, when, as I mentioned earlier as well, as far as OET speaking is concerned, you don't need to worry about that because you will have just the interlocutor to speak to, and the physical environment will be taken care of by OET itself. Okay. Now, which sentence or phrase uh, did the doctor use to check patient's perception about their condition? Did she explicitly ask, or did she use a question uh, that helped her get to know how the patient's or what the patient's perception is? Did the patient have the same perception as their diagnosis, or was it different? Hmm, very good. Yeah. So, yes, Rainy, one of the questions that she used was, um, do you have any depression or anxiety? How about any depression or anxiety? Okay. So here, instead of straight away saying that, what are you expecting from your test results? That wasn't necessary because like, say, for example, here also it was a follow up visit. So the doctor started with, how are you feeling? And what did the patient say? What did the patient think was the reason behind her symptoms? What did the patient think was the reason behind her symptoms? Was the patient's perception right? Perception, again, if I repeat that for you, is patient's belief or patient's viewpoint about their condition. Um, the cancer part that her husband had came later on. Rainy, we have not yet given the knowledge. We are still on perception. So once we told her that she has cancer, she started talking about her husband. But I'm asking about perception. What did the patient think was causing her symptoms? Was she already prepared? Was she already expecting that she has cancer? No. So, what was the patient perceiving? What did the patient think was the reason behind her symptoms? The patient said that I still feel dizzy and tired, and that's because of my blood count, the anemia, isn't it? So, that gave the doctor an idea that this patient is not at all prepared for the possibility of cancer, right? And that is why it's really really important that you first try and find out what patient thinks about their condition before you actually go on to reveal that news to the patient, so that you are better prepared to handle that situation. If they tell you that, yeah, they searched something on internet and then they have found that in with this kind of symptoms, and particularly if the doctor has ordered a CT scan or a biopsy, um, there can be a cancer. So I'm really worried that I may have cancer. So that tells you that, yeah, they are at least 20-30% prepared that this could be cancer. But when your patient tells you that it could be possibly because of anemia, you get to know that they are not at all prepared to accept that this could be cancer. And that could make your conversation even more challenging, right? That is why before you yourself telling the news, you have to follow these two steps: perception and invitation. Perception is nothing but you are trying to find out how much aware that it could be that serious condition, whether they are ignorant about it. Yes, type yes for me in the chat box if perception is now clear. This is something you do before you reveal the news. Yes, Dr. Urvashi, is perception clear now? Okay, okay. What phrase did the doctor use for invitation? What sentence or phrase did the doctor use in the video for invitation? Were you able to write it down for yourself? Then please type it in the chat box as well so that I get to know, could you understand what do I mean by invitation? No, Dr. Rishi, this is not invitation. That is knowledge. You see this here? I hope I wouldn't have to say this, or results are not very good. That is knowledge. Before giving the knowledge, to tell you how much would they like to know about their condition. Which sentence did the doctor use here to ask patient how much would they like to know about their condition? I hope you were watching this video with these 6 steps in your mind, or were you just trying to watch it with no goal? Yeah, yes. Well done, Rainy. Yeah, so the phrase she used to check, to invite is to say, how do you handle medical knowledge? Yeah, how do you handle medical knowledge?
Actually, I
And
was confused. I heard medical knowledge, but I was confused whether it is right or not.
hmm, yeah, so this was the question that she used to invite the patient, whether the patient would like to know everything. So she also gave an example that usually my mother defers to her children, particularly me. So how do you handle medical knowledge? Would you like to know everything? And the patient said, yes, you have to tell me, okay, because I want to know everything. So this is something important, because sometimes what may happen is, you may straight away go to the treatment part, but the patient actually wants to understand what the problem is. And sometimes you may go on into the details of an art physio, and the patient is least interested in it. They just want to know, how much would it cost them, or how much time would it take for them to, how much of hospitalization will be required, or whether they will recover or not, whether they will be able to survive or not. So before you giving the knowledge, check how much patient wants to know. Okay, how much would they like to know about their condition? So that is invitation. And then knowledge. Which phrases did the doctor use here to soften the news, to make it less of a shock for the patient? What phrase did the doctor use? Yeah, I'm afraid, she said, I don't have very good news for you. Okay. So I'm afraid is an expression. It really doesn't mean that we as a medical professional have a fear. It's a similar expression to I'm sorry. Okay. I'm sorry, I don't have very good news for you. And then she also said, um, I wish I had better news for you. So these are the things, yeah. I'm afraid doesn't mean I don't know. I'm afraid means I'm sorry. Okay. So that was knowledge. And how did she handle emotions? What did she do to explore patient's viewpoint. Can anyone of you remember the sentence that she used to explore patient's viewpoint? This was very easy. Come on. What, how did she encourage patient to express her feelings? She said, "Tell me about your husband." Yes. And this actually helped the doctor to understand what fears this patient has, right? Because as soon as she got to know about cancer, she said, "My husband had it." And then the doctor asked more about how she felt about her husband, or how she felt while she was nursing her husband. And then she started talking about the pain that he went through, and whether my children will have to take care of myself, or whether I'll have to wear diapers, and whether I would die because of that. So that was an exploratory language. Okay? So when you reveal serious news, and if the patient has an emotional reaction to it, don't say, "Oh, don't worry, everything will be fine." No, let them vent out their feelings. In fact, encourage them to express their concerns to you. That would be an opportunity for you to help them overcome those concerns, or help them resolve those problems. Okay. And then, of course, when they are expressing their concerns, validate their concerns. So the doctor here said, "I'm glad you have told all these things. Okay, so now I know where you are coming from." So that was also one way of validating the concerns. And that is something which we do in almost all the role plays. So I'm sure this is something which you are already familiar with. In what different ways can you acknowledge the patient's concern? Yeah, I know that it comes as a shock to you. Well done, trainee. That was another phrase. Okay? Or I can see that this has come as a shock. This is another way of validating their concerns. And then she started talking about the treatment. And then step by step, um, she explained it. Could you note any of the phrase that she used uh, to convey positivity? Any phrase that she used to convey positivity, or to highlight the positive aspects of it? We have the best team. Okay. Yes. Anything else? When the patient said, "Would I also die like my husband?" How did the doctor brought positivity to the conversation? Yeah, we should focus on making you comfortable. Well done. Anything else?
You still have many options.
Yes.
We are going to help you.
Hmm. Yes. So the doctor straight away said, "No, you wouldn't die. There are still options available." Okay. And she said, "I have the best team to help you with." Right. So this mnemonic will help you remember the steps, so that you don't forget. What happens usually is, as soon as you see on the role play card that they have cancer, you will start your conversation by saying that your biopsy results suggest that you have cancer. But you're not supposed to do that. Before you reveal that news, you have to find out patient's perception. You need to find out how much would they like to know about it. Then, when you are giving knowledge, you have to use expressions that soften the news that you're going to give. You have to be very slow. You have to pause. Did you notice all those things in the doctor's conversation? The pauses that helped the patient to assimilate knowledge that was being given to her, and then a very low tone to convey empathy. Okay, so, particularly when you're dealing with serious issues or sensitive issues, your tone could also play an important role. So, rather than saying that, your biopsy suggests that you have breast cancer, um, the doctor said that I don't have a very good news for you today. And the biopsy that we did is now it suggests that, and then there was again pause, and then the news was revealed. Okay? So you need to remember that when you're giving that knowledge. When the patient reacts to that situation, don't try to change their emotions. Usually, what happens is when somebody is feeling sad, we try to cheer them up. But here, you actually have to support them, vent out, them to discuss it more in detail so that you get to and so that you can uh, support them in a much better way. And finally, you use empathetic language and discuss strategies with them. Now, I have a dialogue activity for you where we are going to use empathetic language and I want you to complete the dialogue activity. The patient's phrases have been given already so that you know how to respond to that situation. But before we go on to do that dialogue activity, I want you to look at this role play card and understand the context. Use the 6 question strategy. This is the same for both medicine and nursing candidates. Although nurses are usually not responsible for revealing serious news, there are 10% chances that you can have such a task because your doctor may ask you, or you may be a nurse practitioner, so you may need to reveal serious news to your patients, okay, when the patient is coming for receiving their test results. So that can be a case. So it's always a good idea to do one such role play. So I've got the card for you here. Use the 6 question strategy, the setting, whether the patient is known or unknown, what is the patient's mood, or what kind of emotional reaction will they have to this situation, what is the background, medical and social history that is significant, what is the overall agenda of this conversation, and what is your task. Yeah, these are the 6 questions that you will always be using whenever you're looking at a role play card. The first one here says it is a suburban clinic. Whom are we talking to? It says 49-year-old accountant married with 2 children. Is this a known patient or unknown patient? Type for me in the chat box. Are we talking to a known patient or unknown patient? Yes. So here it says they presented 3 weeks ago and you requested a colonoscopy and today they are returning for the results. And again, here in the beginning, it says your patient. Okay, so whenever it starts with your patient, it is known patient. Okay. Anything that is significant from the social history? Anything that is significant from social history? Yeah, having 2 children. Okay. And the medical history says that they have tumor in the descending colon, and that is a cancerous tumor as per the biopsy result. What is the overall agenda? What is the purpose of having this conversation? Why are we having this conversation? to discuss the test results, and to discuss treatment for it. Okay, now do you get any clues from the role play? Read the tasks now, and do you get any clues about how the patient might be feeling about it? Or what emotions will the patient express? Read the task very carefully and find out how do you think the patient would react to this situation. How do you think the patient would react to this situation? I'm not receiving any response, maybe some issues with your chat box. The last response I received was whether this patient is known or unknown. Okay, yeah, Rainy, I just received from your side. Okay, the patient may be anxious. And can you pinpoint why they might be anxious? What concerns they might have? Are you getting any clue from the role play card about that as well? What concerns they might have for the family? Well done, Urvashi. Yes. So here it says validate their concern about the family. And what else? What other concerns they might have about their recovery? Isn't it? It says reassure that complete recovery is possible. Yeah, you're very right. Having cancer can be fearful situation. Yes. Okay. Anything else? Any other concerns that the patient might express? Are you getting any clue? What does this mean? It says explain that a colostomy is unlikely as the tumor is confined to descending colon. What does this mean? Colostomy is unlikely. What does that mean? And does that give you any clue? Uh, okay, I was very much sure. So here, like doesn't mean whether they like or prefer it or not. Unlikely means there is less possibility. Okay, I'm unlikely to visit, say for example, I'm unlikely to attend this meeting. That means there are very less chances that I would attend this meeting. So here, unlikely doesn't mean similar to or not being similar to something. Here it says explain that colostomy is unlikely. That means it is not going to be, there's less chance that this patient will have colostomy. So does this give you any hint about the concerns that this patient would have? You need to tell them that they will not require colostomy because it is located in the descending colon. Does this sentence give you any clue about the patient's concern? Why would you have to tell that colostomy is not necessary when the patient might be worried that they will need colostomy? Isn't it? So that is another challenge or another concern that they may have. So here the colostomy isn't required actually, but the patient might be worried that they will need colostomy, and therefore you need to tell them that it is not going to be required. They won't need colostomy. Okay,
Hello.
and why? Yeah, yes, Reni?
About that, when the patient asks, after that only we have to say, or before? How?
No, only after that.
Okay.
Yeah. So here, like the patient was expressing in the video also. She said that will I need to wear diapers, or will I also die like him? Similarly, when you will be discussing the operation, the patient might express a concern that will I have colostomy, and then you will explain them that no, they wouldn't need colostomy because it's in the descending colon. Okay, and why does it say here, encourage the patient to be optimistic about surgery? Do you get any hint here, any clue? What other concerns the patient may have? Why would you need to encourage them to be optimistic? See, that is why that 3 minute preparation time is very crucial. Okay, so why would you need to tell someone to be optimistic when they are skeptical? Yes, when they doubt whether the surgery would actually help them recover or not, whether they would have fear of surgery, whether they would be fearful of dying in spite of having the surgery. You have to tell them that no, the success rates are usually very good, and therefore they should be positive about the surgery, right? So 3 minutes preparation time, that the 6 question strategy that we have discussed. Today I am adding one more point to that, is to find out what all possible challenges you may have during that role play, right? And it's possible to identify all those challenges based on the background information given and based on the clues given within the role play card. If you pay close attention to that, you will be able to find out what are the possible challenges that you're going to have during the role play. And because you are, aware of those challenges, you can also think how would you handle those challenges. Okay, for example, when they express their concerns about family, how would you reassure them? If they express their concerns about recovery, how would you reassure them? If they express concerns about having colostomy, how would you explain that it is not required? When they express their concerns about the recovery after the surgery or whether the surgery would be successful or not, you will explain them with the success rates and the fact that it is limited to one part of their body. Right? So now let us do this dialogue activity, and you would need to apply the spikes format here. Okay. So see, I have started it already for you, and I have also noted where we will need to change your tone and sound. So since this is a follow-up visit, this is how we would be starting. And I have started with perception. This question would help me to find out what is the patient expecting from the test results, and look at the patient's response. They have told me that it could be some infection or maybe just piles which is causing diarrhea and pain. So what message does this give me is that the patient is not at all prepared for the possibility of colon cancer. Yeah. Uh, would you like me to tell more about your illness, or uh, invitation is not um, seeking permission. Invitation is asking how much would they like to know, isn't it? Of course, you are there to reveal serious news, reveal news, or reveal the test results. So you are going to give. So would you like to know is not the logical question. What we want to know is how much would they like to know? Would you like to know? And you can give them example here that there are some people who would just like to know the basic information, and there are others who would like to know the details. So how much would you like to know about your condition, right? And here the patient would say, I would like to know everything, considering their age and the fact that they have two children. So they want to know everything about it. So this is how they respond, that I mainly want to know about the expenses involved because I have children who depend on me. Now, how would you react to this? Now it's the time for you to give the knowledge. I want you to type your response for me in the chat box. How would you give the news to them? Also use those expressions which will help uh, you to convey your feelings about their diagnosis. And also I want you to write down where would you pause, how would you chunk the information, where would you pause. So in your response mention those pauses as well. I'll just get the details of the tumor here. It says it is a 2 centimeter tumor, and it's confined to wall. So it hasn't spread, and it's 2 centimeter in size. So when you are giving knowledge, of course, you will have to handle those, you'll have to include those details of diagnosis as well. I would refrain from using the term bad. Um, that is why, if you notice, even in the video and the expressions that I had written, we say that I don't have very good news for you rather than saying I have bad news for you. Refrain from using negative terms which may hurt your patients. And um, instead of directly saying unfortunately, I would prepare the patient by giving them some forewarning. Yeah. And I would specify that you have a small tumor, since it is 2 centimeter. So to add some sort of relief. That is the reason also right from the beginning I have been using term serious news. If you guys noticed it, I didn't say bad news. Okay. Well done, Rainy. Very good response. So first I will give them some hint that what I'm saying, going to say, or what I'm about to say could be unpleasant, could be shocking. Okay, and then we would give them the result. So here also I will have a pause. Your test result shows a pause, and then there's 2 centimeter tumor. So till this point I haven't said that it is cancerous, but then after this, once they have assimilated that news, I would say, and the biopsy that we did uh, shows that it is cancerous. So in 3 steps, we are giving the bad news, the serious news, rather than straight away telling that you have third stage of cancer or fourth stage of cancer. I hope you get the idea clear. Now the patient says, how is this even possible? I'm just 45. I have so much to achieve yet. I don't want to die so soon. And how is my family going to survive if I die? How would you handle the emotions here? Use one sentence for exploring their concerns, and one sentence to show empathy. Don't try to change their emotions. Okay? Handling emotions when it comes to revealing serious news. Remember 2 things: encourage them to vent out their feelings, and don't try to change their emotion. Don't try to cheer them up. That's illogical. Nobody can be cheered up, right? When you are revealing news about some irreversible disease conditions, or disease condition which are untreatable, fatal, or advanced form of disease conditions which cannot be cured. Basically here you are trying to normalize their response so that they feel that you are not judging them, and they can be free to express their feelings, and you are there to support them. Okay, so yes. So I know this comes as a shock to you. Pause, okay, and we are going to guarantee you that you will receive best treatment, and I'm glad you are. Now here, probably we can still encourage them to talk more about it. So instead of directly saying, "I'm glad uh, you would share your feelings with me," instead of that, I would say, uh, would you like to open up more, or would you like to discuss your concerns more in detail with me? That will be my exploratory language. Okay. Similarly, here I have response from you, Urvashi. Yeah, so a reassurance uh, about it, and then you need to encourage them to talk more about how they are feeling, so that would give you an idea about why they have a fear of dying, or why they have a fear of their family's survival. So this might be related to some of their previous experiences, and if you encourage them, they would talk to you about it. Okay, so that one more phrase needs to be added, Urvashi, in your response. And once you have handled their emotion, you will be discussing strategies with them. So when you are discussing strategies, again, you will be following the same principles that you follow when you are giving information, right? The steps that you follow, using signposting language, categorizing, labeling. So I'm not going to do further practice on that because it is something we have already done before. But if you want to give it a try, you can complete the remaining of the role play as well, the remaining of the dialogue. And then I'm going to also upload the teacher's copy so that you will be able to compare your responses with the responses given there. For now, we are moving on to the second challenging situation that you can have is dealing with sensitive issues. Again, I want you to read this role play card, rather interpret the role play card using 6 question strategy, and add the seventh point. What do you think would be the possible challenges that you may have while doing this particular role play? Interpret the role play card carefully first. So it's a home visit, and whom are we talking to in this case?
David Gill.
Mhm. Yeah, and he is the full-time carer, husband of Jill, who has multiple myeloma. Do we know them already?
Yes.
Here it says you visit Jill at home once a week and have observed repeat deterioration. Okay, so now let us look at the possible challenges that we may have while dealing with this particular situation. Can you type that for me in the chat box? The first challenge, What all challenges would you have when you are talking to David? It says here that he looks as exhausted. Yeah. So one thing that could be challenging here is the husband himself is exhausted, but at the same time, he isn't willing to transfer the patient into the palliative care home. So that's going to be a challenge convincing him because, again, looking at their age 45, 46. Okay. Then here it says that uh, recommend admission to nearby palliative care hospital and discuss benefits that for the whole of the family. So here also you get an idea that he may not be willing to transfer the patient into the palliative care home, and then you will need to discuss the benefits so that he finally gets convinced. So in many ways, this is going to be a sensitive situation because they have children to look after, two teenage children to look after, and wife if she's ill, if she's going to be moving to the palliative care home, looking after the house, the children is a challenge. And at the same time, you can see that David wants to be with her. And at the same time, he has responsibility of the home and the children as well. Right? So handling his situation, convincing him uh, to move Jill to the palliative care home, these are the challenges that you will be having. The only reason why we are looking at different role play cards today is to give you some practice on how you can yourself identify the challenges by looking at your role play card. See, in exam, you will not have the patient's card, you will only have your card to look at. Okay, and looking at that, you will have to assume, predict, anticipate the possible challenges during the role play, okay, or how would you handle those challenges. So doing this practice would help you anticipate that, and you will be able to understand how you can do it in 3 minutes preparation time. So there's a lot of burden on that 3 minutes. It's not just reading the role play card, it is actually anticipating what would be the possible challenges and planning how would you handle those challenges. Let us look at one more role play card. Here I have given you the transcript so that later on you can go through the transcript and see how that will be handled. And you have another role play card here. Again, I want you to analyze this role play card, particularly for what possible challenges you may encounter while communicating with this patient. So interpret the role play card using 6 question strategy and start typing for me in the chat box the possible challenges while you are going to do this role play with your patient. What would be difficult for you? It says the patient you notice that the patient feels lonely and depressed, how will this be challenging for you? Or what challenges will this create for you? How do the patients react when they feel depressed or lonely?
They cannot express their own feelings.
Very good. Yes. So the first challenge I would have is to encourage them. Okay. So the challenge that would be there is the patient may be reluctant to express their feelings, or they might be, not speaking much. They might not open up. And what I would have to do to handle this is to encourage them by developing trust, ensuring them about confidentiality, and showing empathy. Okay, what could be another challenge? It says they require dialysis 3 times per week and is a candidate for renal transplant. And in the task, it says inform the patient without dialysis, he or she would suffer more. Does this give you any clue about the patient's uh, concerns or their mood? What could be another challenge that you may have here?
Maybe the patient is not willing for the dialysis.
Not willing for the dialysis. Okay.
Or she may not know the seriousness of not having the dialysis. Maybe.
Yes. So they have been having it for many years. So they might know why it is required, but they may not be aware about the consequences. So you may need to explain the consequences, right? Here it is not someone who doesn't know anything about dialysis and you would need to tell everything about it, but what may happen if dialysis is not continued? Okay, the third possible challenge, it says reassure that there is always a hope that the donor will be found. Does this give you any clue about the possible challenge?
Maybe the patient is not willing for the surgery, but we have to convince him by saying that we might get a good donor if you are willing
Hmm.
for the surgery.
So it says that there is always a hope. So the patient may have lost hope of getting the donor, and that is why we need to tell them that there is a hope, and they might not be patient enough to wait until the donor is found. Okay, fourth challenge. And what would we do here is we will try to, have positive approach and tell them to have faith, or tell them to not to lose hope. Okay. Anything else? Any other challenge? Yes, Dr. Rishi, feel free in whichever way you are comfortable. You can either type or you can unmute yourself, whatever you are comfortable with. What could be another challenge? Here it says uh, a counselor be consulted to support the patient's decision to be listed on NFR. Does this give you any hint about the possible challenge? Why would you need to suggest? counselor.
Actually, I did not understand the question.
Hmm.
Why
So
the
here it, yeah, so here the patient is, it is telling us, the task is telling us that we should tell the patient that if they want to decide for NFR, then they need to see a counselor. This NFR is, in some countries it is referred to as DNR, do not resuscitate. And here in the Western countries, it is NFR, not for resuscitation. So, what do you think the challenge you may have here? Doesn't it tell you that the patient may request to be listed, okay, on NFR, and see what kind of a situation will it be, right? When somebody himself is accepting, or when somebody himself is ready to write their own death declaration. Isn't NFR something similar to that? When the
Yes.
person himself tells that you please don't revive me. So this can be very, very challenging, but particularly handling their emotion, okay, when they have completely lost hope in their recovery. So these are a few challenges that we may encounter while doing this role play. Yeah, or it is also possible that they may deny um, any further treatment. That is why the NFR, of course. Okay, right? So this is something you can do when you are looking at a role play card so that you can be better prepared to handle such challenges. Now, what we are going to do next is uh, first, I'm going to play patient's role for both of you, and I want to give you some tasks, and I would be making you do these tasks with me. You would be playing the role of a nurse or a doctor, depending on which profession you are from. Okay, so for the first four bullet points, um, or let us do this way. Okay, first two bullet points I want Dr. Urvashi to handle. Then next bullet point, Rainy. Next two bullet points, third and fourth. Again, fifth bullet point I want Dr. Urvashi to handle, and sixth, Rainy. Am I clear? First two, Dr. Urvashi, three, four, Rainy, fifth, Dr. Urvashi, and sixth, again, Rainy. And I will be playing the patient's part for you. So I'll be asking you to unmute yourself in a moment, like take some time, about 40 to 60 seconds. Prepare yourself for this. I will be playing the patient's part for you, and I want to see how are you handling this situation. Are you able to use empathetic tone, pauses, and expressions to handle this sensitive situation? Okay, so Dr. Urvashi, you can now unmute yourself and we can start doing this role play.
As I look you are so depressed. Anything else you want to share with me?
Um, I just can't stop thinking about my condition.
Yes, anyone who receives dialysis 2 or 3 times a week, they feel very nervous at the end of treatment. But it is one hope to live. So, can you tell me what is the condition that end up with your fearful condition?
Um, it has been 10 years since I am having dialysis, and uh, I think it is not helping me in any
Oh,
way. Uh, I feel that it is making me more sick.
yeah.
And I really don't like getting admitted to hospital very frequently.
Yes, I am sorry to hear that.
So, I think I can't bear with this anymore. I really just can't keep going through dialysis 3 times a week, and I would really like to stop
No,
the dialysis. Over to you, Rainy. This is your part, and I'll come back to you, Urvashi, once again.
Uh, uh, yes, ma'am, Mrs. Dear, I can understand your feelings for what you're going through, but there is always a hope. As you know that you have some difficult situation you're facing now, uh, there is always a hope that you will be having a donor in time.
Uh, but I have completely lost all the hopes, nurse, because if I couldn't find it in 10 years, I don't think I will ever get the donor, and I really don't want to continue with the dialysis. I just want to stop dialysis now.
I can understand your concerns and I can understand your feelings, but don't lose your hope, as there is always a chance that you will have a good donor, and you can the surgery will be successful if you go for a renal transplant, and you will have a better life ahead. So you don't have to worry about that, and you can also continue your dialysis. So and also your success rate will be good. Are you able to follow me?
Uh, you know, uh, I don't think I want to live a life like this. Over to you, Dr. Urvashi. Uh,
yes, ma'am.
I just think that if anything goes wrong, like if
Yes.
I've seen that sometimes people crash, and then you try really hard to revive them. But I want to tell you, doctor,
Uh,
that please don't do all these things for me. If
yes.
I at all get a cardiac
Oh,
arrest, I would
mhm.
better prefer dying than living a life like this.
I understand it must be difficult for you for go through these all situations. So in this situation, we can do one thing as a last resort that we can post you as listed as not for resuscitation, and for that we have to suggest a counselor that he might discuss the uh, situation of all the things in detail with you.
You see, doctor, you were very close to me, so I disclosed all my feelings with you. But I don't really want to see a counselor. Um, you know, I'm sure they would try to convince me to continue with dialysis, and I don't want to do that, and I don't want to discuss my private matters with anyone else. Yes, Dr. Rishi, you need to. How would you respond to this?
I know,
Hmm.
I know you are very close to me, and you can talk freely with me. But the sometimes we have to follow the hospital's policy, and might be you feel more free with a counselor than with me. It might be happen, and sometime after talking with counselor, your decision might be changed.
Uh, I wouldn't really like to talk to the counselor. Like, can't we skip that step?
Uh, it is, one type of legal policy. So we have to respect some policies of hospital, and in that cases, we have to inform your family members too. So
I see.
you have to follow these rules too.
Okay. So over to you, Rainy. How would you continue this further?
Okay. I can understand your situation. Plus, please make yourself little comfortable. Don't feel don't feel that you're alone. I'm here to help you. You you still have more options. Uh, See, according to our hospital policy, uh, I can provide you some information that you can put your request in writing, as it is our hospital policy, and your family presence is very important to fulfill some legal formal to complete some legal formalities.
Mhm.
Are you able to follow me? Do you have any questions?
No, I think okay. Yeah, if it is necessary, then yeah, I'll do that. But this sounds really awkward uh, to me. Okay, so yeah, so here I think Rainy, using that you have other options or I have other options was not the right word, because we were not discussing options here. We were talking about the steps that we'll need to follow. So right from the beginning, even Dr. Urvashi, when you were discussing about the counselor, you should have used the categorization statement that if you do decide to be listed on NFR, then there are certain legal formalities that we will need to complete. First of all, you'll need to seek a counselor, and then Rainy, you could have started by saying that once the counseling part is done, uh, we would also have to do some paperwork. I'm afraid you will need to sign a document, and then you can say that your family should be present when you are signing this. Okay, now what we are going to do next is we are going to show you what is an ideal way of having this conversation. So now I will be playing the doctor or the nurse's part, and Soumya will be helping me to play the patient's part so that we can get that real emotion into this role play. And listen to this very carefully to understand how this is going to affect, or how are we implementing the right kind of tone, pauses, and stress patterns to convey empathy. Okay? Give me a moment and we'll start this. Hello. Soumya, some issue with the speaker, I suppose. No, your voice is cracking.